Hello, and welcome back to the channel. Our human population increases by reproduction. For the majority of people, this is a spontaneous event following intercourse between a man and a woman. However, some couples may find it difficult to achieve conception on their own after some time trying. They could become unsettled and seek help from the medical profession. Let's look at some sample questions to illustrate the concepts that might arise during an infertility consultation. As part of an initial assessment for fertility problems, a 29-year-old woman attends the surgery to have a blood test to measure serum progesterone to confirm ovulation. When should she be advised to have the blood test? And select one option only. A. First day of her period. 7 days before her next period is due. C. 14 days before her next period is due. D. 7 days after her next period. E. Mid-cycle. The correct answer is D. A mid-luteal phase progesterone should be measured in all women being investigated for fertility issues to confirm ovulation. The sample should be taken 7 days before the expected period, for example, day 21 of a 28-day cycle. A 36-year-old man attends your surgery asking for a referral to see a fertility specialist as he has been trying to start a family with his partner for the last 12 months without success. He has a history of asthma, type 1 diabetes mellitus, and ulcerative colitis. His semen analysis reveals the following results: volume 2.3 milliliters, pH 7.9, total number of spermatozoa 8 million, concentration of spermatozoa 3.5 million per milliliter, motility 63% motile, and morphology 29% normal forms. Which of the following drugs is the single most likely cause of this patient's semen analysis result? Select one option only. A. Insulin. B. Ramipril. C. Sulfasalazine. D. Aspirin. E. Montelukast. The correct answer is C. Sulfasalazine can cause oligozoospermia or low sperm count, although this is usually reversible on stopping the drug. There are 3 reasons to see your GP if you are trying to get pregnant but are not successful on your own. Your GP can offer advice and information to help optimize the chances of a successful pregnancy. Secondly, to initiate fertility testing, and finally to evaluate the need for referral to specialist fertility care. Patients experiencing prolonged periods of unwanted non-contraception may feel shame, apprehension, or uncertainty about the process involved in achieving fertility. This makes these consultations usually sensitive. There is good news. With a little awareness, your chances of spontaneous contraception can be improved. When a woman is younger than 30, she has an 85% chance to conceive within 1 year. At the age of 30, there is a 75% chance to conceive in the first 12 months. Barring any obvious medical limitations, these chances increase to about 94% by the second year, with consistent regular intercourse of at least 2 to 3 times a week. Naturally, this chance declines to 66% at the age of 35 and 44% at the age of 40. This is due to the effect of aging on the ovary and eggs. Men can still have fertility problems even if they can still have an erection and have an ejaculation. Men's fertility also starts to gradually decline around age 40 to 45 years. The decrease in fertility is caused by the decrease in the number and quality of the sperm they produce. NICE guidance recommends that women of reproductive age, along with her partner who have not conceived after 1 year of unprotected vaginal sexual intercourse, should be offered further clinical assessment and investigation. In order to achieve pregnancy, 3 elements must be present: healthy sperm, a healthy egg, and access to the fallopian tube. The main causes of infertility are as follows. The percent figures indicate approximate prevalence. Unexplained infertility with no identified male or female cause accounts for 25%. Ovulatory disorders also make up 25%. Tubal damage contributes to 20%. Factors in the male causing infertility are responsible for 30%, and finally, uterine or peritoneal disorders account for 10%. There are 7 recommendations that form part of the initial advice to people who are concerned about their fertility. Regular sex, vaginal sexual intercourse every 2 to 3 days per week increases the chances of conception. Sensible alcohol consumption, 1 to 2 units once or twice per week for women, and avoiding episodes of intoxication reduces the risk of harming a developing fetus. Excessive alcohol intake, above the recommended limit of 3 to 4 units per day for men, is likely detrimental to semen quality. Smoking, active and passive smoking, is likely to reduce fertility, increase the risk of miscarriage, and cause obstetric complications. Weight. Men and women with a BMI over 30 are likely to take longer to conceive. Those with a BMI of less than 19 and irregular menses should be advised that increasing weight will help fertility. Rubella status. Women susceptible to rubella should be immunized prior to conception and advised not to conceive for at least 1 month after the vaccination. Cervical smear. Women should be up to date with their cervical cancer screening. Things of variable evidence but worth mentioning are that caffeine may affect the success of fertility treatment like IVF in women. In men, tight-fitting underwear is associated with elevated scrotal temperature and reduced semen quality, but it is uncertain whether wearing loose-fitting underwear improves fertility. Multivitamins. Women intending to become pregnant should be informed that dietary supplementation with folic acid before conception and up to 12 weeks gestation reduces the risk of having a baby with neural tube defects. So what is infertility? Your GP typically defines infertility in practice as the period of time a couple having fertility-focused intercourse has been trying to conceive without success, after which formal investigation is justified and possible treatment implemented. Subfertility generally describes any form of reduced fertility that results in a prolonged duration of unwanted lack of conception. For individuals under 35, infertility is usually defined as trying to conceive for 1 year without success. For individuals 35 and older, the time frame is shortened to 6 months, as fertility naturally declines with age. After this period, your GP should recommend tests to assess fertility and consider referral to explore treatment options, such as medication, assisted reproductive technology, or other interventions. Your GP would usually use the word subfertility during consultation unless there is concrete evidence of a lack of prospect of spontaneous pregnancy. In this case, early referral for assisted reproduction treatment would be required. What are the investigations undertaken in primary care for fertility problems? If there are no apparent causes found through history and examination, and the couple has been trying to conceive for at least 12 months, then your GP will conduct baseline investigations to rule out any serious conditions that may not be evident from the medical history. These include hormone profile tests, like checking the follicular-stimulating hormone and luteinizing hormone on any day between day 1 and 5 of the cycle to identify women with FSH above 12, but still having regular periods, as this may suggest that they have reduced ovarian reserve. Also check progesterone 7 days before predicted menses. This is done for women with regular cycles between 26 and 36 days. If the progesterone level is less than 30 nanomole per litre, the woman may not be ovulating, so consider referral. If it's between 15 to 30, then it may have been mistimed. In this case, consider repeating the test. Remember, this particular test is not needed if the woman's periods are irregular. Other tests will include chlamydia serology. This test is looking for evidence of past or chronic chlamydia infections that might have caused hidden damage to the reproductive system. If the titer is greater than 1:64, there is an increased chance of tubal blockage and adhesions. Also, consider requesting an ultrasound of the pelvis if a pathology like fibroid is suspected. Semen analysis. The man should have a first semen analysis, and if the result is abnormal, then repeat it after 6 weeks. Ensure the patient has understood advice about the abstinence period and how to collect a complete sample. In the UK, there is usually a dedicated lab to receive and process semen for analysis. Use the link in the description to read more about how to collect sperm specimens. As a rule of thumb, there are 3 semen characteristics which are clinically relevant. 1. The amount, as expressed by the total count in the ejaculate or concentration per milliliter. 2. Motility, as expressed by the proportion of total motile or progressively motile sperm. 3. Morphology, as expressed by the proportion of normal forms. A normal semen analysis requires all 3 characteristics within the reference range. If 1 out of the 3 characteristics is low, the odds of male infertility increase 2 to 3-fold. If 2 out of 3 are low, the odds increase 5 to 7-fold. If all 3 characteristics are low, the odds of infertility increase 15-fold. Consequently, the more abnormal a semen analysis is, the higher the chance of male subfertility. What are the conditions for early referral? 1. Women aged 36 years and over. 2. When there is a known clinical cause of infertility or history of predisposing factors for fertility. And 3. Where a treatment is planned, like during cancer treatment, an early referral should be offered. For couples who either has HIV, Hep B or C, any discussion about fertility management should be the result of discussion between the couple, a fertility specialist and a specialist in HIV hepatitis. Couples with a reasonably good prognosis, for example in unexplained infertility, may be encouraged to wait because even with treatment they do not have a better chance of conceiving. The others may benefit from an early resort to assisted reproduction treatment. What can you expect in secondary care when referred? Once a reason for the infertility has been established, treatment falls into 3 main types. Medical treatment to restore fertility when possible. For example, the use of drugs for ovulation induction. Surgical treatment to restore fertility when possible. For example, laparoscopy for ablation of endometriosis. Assisted reproduction techniques, ART. Any treatment that deals with means of conception other than vaginal intercourse. It frequently involves the handling of gametes or embryos. What are the medical treatments to restore fertility? For males, gonadotrophins, usually given as hormone injections, are offered to men with hypertrophic hypogonadism. This condition happens when the body doesn't produce enough hormones needed for normal testicular function, which can lead to low testosterone levels, infertility, or delayed puberty. For women, pulsatile administration of gonadotrophin-releasing hormones or gonadotrophins like luteinizing hormone are given in hypothalamic pituitary failure. This treatment is used for people who have fertility issues due to the brain not sending the right hormonal signals to the reproductive system. Clomiphene, metformin, or a combination is given in hypothalamic pituitary ovarian dysfunction, like you find in polycystic ovary syndrome. Clomiphene is used in ovarian stimulation to produce more ova or eggs. Dopamine agonists like bromocriptine are used in ovulatory failure due to hyperprolactinemia. Prolactin is a hormone that, when in excess, can suppress ovulation in women. Causes of abnormal high prolactin include prolactin-secreting tumors in the brain, hypothyroidism, and certain medications like antipsychotics, antidepressants. What are the surgical treatments to restore fertility? For males, men with blocked tubes ALS, called obstructive azoospermia, may be offered surgical correction of epididymal blockage. Men should not routinely be offered surgery for varicoceles as a form of fertility treatment because it does not improve pregnancy rates. For females, 1. Laparoscopic tubal surgery in mild tubal disease. 2. Tubal catheterization. 3. Ablation of endometriosis. 4. Hysteroscopic adhesiolysis in those with adhesions. This means that if someone has scar tissue inside the uterus, which can occur after a pelvic infection, gynecologists can remove it using a thin, flexible camera, hysteroscope, inserted through the vagina and cervix. This procedure helps improve fertility and menstrual health. What are assisted reproductive techniques? These are any treatment that deals with means of conception of the vaginal intercourse. These include intrauterine insemination, IUI, in vitro fertilization, IVF, intracytoplasmic sperm injection, ICSI, sperm and egg donation. Eligibility criteria for IVF may vary from one local area to another in the UK. A typical NHS funding criteria for a couple would cover 4. Female age less than 40, with no living children together who have been trying to conceive for at least 2 years. The woman is expected to have a BMI less than 29.9 and a confirmed non-smoker for 6 months. Most clinical commissioning groups in the UK only sponsor 1 cycle of IVF. Same-sex couples are entitled to 1 consultation in a specialist fertility clinic, but they would be expected to self-fund any further investigation and treatment. There are services in place to support families who, due to certain circumstances like severe medical conditions, would not be able to conceive. These couples can be signposted to surrogacy and adoption services. In the UK, you can access both surrogacy and adoption services. However, it's important to note that surrogacy is only permitted under specific legal conditions. These conditions primarily involve altruistic arrangements where the surrogate is not financially compensated beyond reasonable expenses. Legal parenthood is typically established through a court order called a parental order after the child's birth. If necessary, an adoption order may also be pursued depending on the circumstances of the case. Key points about surrogacy and adoption in the UK. First of all, surrogacy is legal. While surrogacy is allowed, it's regulated by law and cannot be commercially arranged, meaning surrogates can only be reimbursed for reasonable expenses. Secondly, to become the legal parents of a child born through surrogacy, intended parents must apply for a parental order through the court. Thirdly, if the intended parents are not genetically linked to the child born through surrogacy, they may need to apply for an adoption order to gain legal parenthood. A final point is to use registered agencies. It's recommended that registered agencies be used for both surrogacy and adoption to navigate the legal process and ensure ethical practices. I hope you found this helpful. Don't forget to like, share, and subscribe to the channel for more educational videos.